Exercise is your best insurance to lower your risk of cancer. So how does it do this? What is the mechanism? What exercise does is it reduces insulin and what's called IGF-1, which stands for insulin growth factor 1. And so both insulin and IGF-1 are signals for cancer cells to grow. And when you exercise, those both diminish. So that's your good effect there. Also, exercise decreases inflammation, and inflammation chronically is that fire that also boosts growth of cancer cells, and it drives cancer progression. So that's benefit number 2. And benefit number 3 is exercise enhances your immune function. So it increases your natural killer cells, which are out looking to destroy cancer cells. So the bottom line is exercise also has great effects on mood, on cardiovascular health, metabolic health. It builds strong bones. What else did I want to say about that? Yeah, those are the main ones. So if the moral of the story is that at some point it is estimated that most Americans will get some sort of degenerative chronic disease. And if you're somebody who has been exercising in your decades leading up to this, your results, meaning getting a less serious disease, responding better to treatment, are all much enhanced if you're somebody who's been exercising. So how much, how often? The ratio, or the window, I should better say, is anywhere from 150 minutes to 300 minutes per week that you want to shoot for. Now, this is at moderate exercise level. If you're doing something like high intensity interval training called HIIT training, you're running flat out, that's more strenuous, and you can actually cut the minutes in half, so you get sort of a 2-for-1 for anything you're doing that's high intensity, so you can keep track of that. And there was a lot of research, and again, this is mostly dealing with cancer prevention and treatment, that had to do with what type of exercise. And pretty much it came to a balance of aerobic, but also either the high intensity or the resistance training. The weight training was very, very important. And we know weight training is important for building bone strength. So it's not just one or the other, a combination, but really including either high intensity or resistance training. And you can certainly resistance train at a moderate level. And you can basically, when you're looking at cancer and trying to sort of trap these cancer cells and not allow them to eat, there really does seem to be a benefit to exercising as many days a week as you can, and not just saving it for the weekend. Now, there are studies, if you don't have cancer, that you can kind of, doesn't matter. You can have one day where you do 5 hours sounds intense, but you know, you can do 150 minutes on the weekend, and a lot of benefit from that. But then other studies looked at the fact that if there are any tumors that are shedding tumor cells, you really want to have regular exercise, kind of getting your blood activated to not allow these tumor cells that are shedding from the tumor. They're called circulating tumor cells. So they're circulating through your bloodstream and your lymph system. Exercise will sort of increase the shearing force on these cells and kill them off, basically. And so you want that to happen pretty often throughout the week and not save it for 1 or 2 days. So you know, you can think about it depending on your level of health and what you're trying to accomplish, but certainly any exercise is better than no exercise. We can emphatically state that. But then understanding resistance training and aerobics, doing it regularly is really, really important. And you know, if one person, you got to write to me, that one person, hopefully more than one, has decided to exercise as a result of seeing this video, that'd be great. You know, we really want to inspire it in our children and our friends, you know, do it together, and it's so beneficial. It was an interesting study mentioned looking at exercise and its benefit psychologically on patients with cancer, because the researcher I was following on this was talking about the fact that somebody gets diagnosed with cancer and it's like nothing's normal anymore. Nothing in their life is normal. And obviously they're very stressed, and stress tends to increase cancer cells. So, you know, what do you do with that catch-22? And they found that exercise really did help mood. We know it helps the cancer diminish in intensity and recurrence. We have that. But this sort of psychological benefit was really key, with patients saying, this is something that's normal for me. Like, say you're a tennis player and now you've been diagnosed with cancer and you go out and you play tennis. It's like, okay, this is normal. Like, this is life being normal, and you feel better about yourself. So that's another aspect of exercise that's really key to note. Also, there's been many large randomized control studies on exercise versus SSRIs, which are the antidepressant medications, showing exercise to work just as well, if not better, than SSRIs. So that's very interesting, because then you have exercise not only showing to improve mood, but helping cardiovascularly, metabolically, bone density-wise, all these benefits of exercise versus some rather dangerous side effects associated with the SSRIs. Another study that I thought was really interesting was looking at breast cancer patients. So women who had suffered breast cancer who exercised during their chemotherapy treatment had a lower risk of recurrence of their breast cancer. So lower risk of recurrence or dying from the breast cancer, and they were followed for 8 years. So it was a very long, follow-up with these women. And they also mentioned that the cost for recurrence of breast cancer and treatment was $1 million. Now, obviously, this is not a dollars and cents thing. This is a life and death thing. But the cost of the healthcare system is, I had no idea it was $1 million. Did you? Quite a huge number. But exercise. These women had breast cancer. They exercised during treatment and of course afterwards, because this was an 8-year follow-up, and the risk of recurrence went way down. So that was all the things I wanted to share with you. Although if you know somebody who is suffering with cancer, their oncologist should know, because it's now considered standard of care in that profession, in the oncology profession, of the benefits of exercise during treatment. And so definitely make sure they check with their oncologist, who should be up to speed on this recommendation, because this is a shift. They used to say just rest, stay in bed, if you're tired, lie down, don't force yourself to do anything. And now pretty much the opposite recommendation is being given, with strong research to support it. So not just for cancer prevention, but for so many other benefits, we need to exercise. We need to do it often. And you just have to get out there, find something you enjoy doing, find a friend you enjoy doing it with, get a trainer if that's possible. There's a lot of online videos that cost you nothing. You just, get on YouTube like you are right now and find some exercise leaders that you like, that you can get inspired by. But it's really, really important that you start exercising and have it become a regular part of your life. It literally could save your life, and it costs you nothing. So I hope you enjoyed this video. Please share it with others. Subscribe to the channel so more people can see this information, and I'll talk to you soon.